Hi, I am Dr. Praveen Kumar M, consultant rheumatologist at the Daivik Arthritis and Rheumatology Center, Nagarabhavi. Today, I will explain the relationship between the obesity and the rheumatic disease. So, decreasing your body weight by 5 to 10% will improve your joint and also helps to cut down your medication burden. I will explain how it will help to improve your joint. So, what is obesity? Obesity is just a simple increase in the body fat. So it is defined by body mass index. So it's a simple calculation of weight divided by height in meter square. So if it is more than 25, it is considered as overweight, and if it is more than 30, it is considered as obesity. So these are the foreign guidelines and the foreign standards. So in Indian standards, 23 to 25 is considered as overweight. More than 25 is considered as obesity. So it is also defined by the abdominal circumference. So in males, the abdominal circumference is more than 90 centimeter, or in females, if it is more than 80 centimeter, they will come in the category of obesity. So you will be wondering how obesity will affect the joint or autoimmune diseases. So obesity will affect directly and indirectly. So indirectly, obese patient will put more weight on the joints. More weight means more load on the joints. So which are the joints which are affected? Common joints are knee, back, foot and the hip joints. So indirectly it can increase the inflammation. So obese or fat mass is not an inactive tissue, it's an active tissue. It can produce the inflammatory mediators which can increase the inflammation in the body. So obesity is like a fuel to the fire. If you take fire as an inflammation. How obesity will increase the development of the joint disease, in particular rheumatoid arthritis. Obesity increases the risk or a chance of developing of osteoarthritis of the hands and osteoarthritis of the knee. It can increase the destruction of the cartilages. Obesity also increases the development of the gout, because obese patient will have more uric acid because their body have less insulin, which helps to excrete the uric acid in the urine. In a rheumatoid patient, if the patient is obese, then those patients will tend to have a more aggressive disease and more pain, more fatigue and also less response to the drugs. In back pain patients, either because of the mechanical low back pain, because of spondylosis or because of ankylosing spondylitis, in those patients the mechanical load on the spine will be more in the obese patient and they will tend to experience more pain. Having said that, how the obesity affects your joint and increases the risk of the development of a degenerative disease like osteoarthritis and also the rheumatoid arthritis, we should focus on a weight management, either through a diet modification or through the exercises. So coming to the diet, you should cut down your calories, decrease intake of ultra processed food, decrease the intake of refined carbohydrates, decrease the intake of high carbohydrate products. At the same time, you should also consume a high protein diet, food which is rich in vegetables. Apart from these, you should move, meaning you should exercise. Either you should do a brisk walk at least for a 15 to 20 minutes per day for 5 days in a week, or you can choose a cycling, swimming, running, so any other aerobic activities. Apart from these, you should also sleep at least for 8 hours a day, because the alteration in the sleep itself can lead to indirectly to a obesity. So overall, healthy weight can reduce the inflammation, increase the mobility, improves the quality of the life and ultimately decreases the chances of development of many diseases. So the tagline is mobility is the new medicine.